My name is Dr. Nezami, and I have the pleasure of interviewing here for our dearest patient, Shannon O'Brien, who was diagnosed in 2009 with advanced breast cancer and went through conventional treatments unsuccessfully. At that time, she had metastatic lesions to the adrenal gland. Unfortunately, although she was totally compliant with conventional treatments, including surgery, radiation, and chemotherapies, all these treatments failed for her. She went through carboplatin taxotere chemotherapy, which is the standard chemotherapy for her type of tumor, along with Herceptin. All these chemotherapies were given through the standard method and procedures. Then she was claimed to be cancer-free and in complete remission by July of 2010. Nobody had any idea of what maintenance treatments she should do and how she should be screened for the possible recurrence. She was told that she's fine and she needs to live her life for a long time. Unfortunately, on one of her visits to Fresno, she developed seizure. And this happens just 11 months after she's claimed to be cancer-free in June of 2011. Immediately she gets admitted to the hospital, and the CT and MRI of the head shows that she has separate masses in her brain. 5 separate enhancing lesions in brain are diagnosed. She now is claimed to be terminal, stage 4 advanced cancer, and unfortunately the treatments conventionally for her are very limited. She's given the options of surgery, radiation, and chemotherapy again, and she fully commits herself and shows full compliance with all the doctors and oncologists' recommendations. And all these oncologists, they start her on chemotherapy. She gets full radiation to the head, and she undergoes a surgical resection of her masses in the brain. After all that, her further scans shows that despite her compliance and despite all the aggressive treatments with toxic side effects that she went through, unfortunately her tumor has progressed, and all of these treatments have failed. That's when she goes and tries to find alternative treatments for cancer. And in this journey, she finds us back here in Fresno after traveling across the country and seeing many, many doctors and hospitals. She comes back here to Fresno, she sees us, and we start her under treatment. When I saw her, she couldn't walk. She was completely disabled. She had pain level of 9 out of 10. And all of us in the clinic were amazed and challenged by the severity of her condition. We started her immediately on epigenetic therapies that we have invented in the last 2 years. She started to respond to the treatment in a matter of just a few days. Her quality of life improved, her function improved, and her pain level decreased from 9 to 0. She didn't even remember that she had pain. After a few weeks of treatment, we repeated her labs. Her labs confirmed that her circulatory tumor cells have dropped from 1,000 to 700, more than 30% decrease in just a matter of a few weeks. That test is approved by FDA, and it shows and correlates with prognosis, means that she's going to live longer. Now she's here, and I love to have her also talk and tell us the story of her journey.
I'm Shannon O'Brien, and for the last about 3.5 years, my life has basically been a lifetime movie. It started out in August of '09. I was diagnosed with stage 4 cancer, breast cancer, and that was a month after my husband of about 10 years and 2 little girls filed divorce. So I got to learn how to be a single mom and do the whole cancer thing. And over my cancer journey these last few years, I'm trying to think, I had the breast cancer, which has metastasized to 4 other body parts, and I have been able to, up until now, successfully fight the cancer and get it out of all of those body parts. Now I'm here at Dr. Nezami's office. He's an amazing doctor that some great friends of mine have educated me about, and he is the only person that I feel through research, through word of mouth, through everything, that is going to be able to turn around my cancer and completely get it out of my body. I'm stage 4, I'll never be cured, but the cancer can be gone. I can have it cleaned out of my body, and through his treatment and through his maintenance program, I can live my goal of raising my daughters to be great, strong women I know they're capable of. So please donate to our fund and help extend my life so I can achieve that